Very good morning to you.
Morning, Mike, and thanks for having me on.
Not at all. Good to talk to you. I mean, this was ever thus, wasn't it? That when a Labour government gets in, the unions all rub their hands together with glee and basically have a couple of conversations with various different organisations and find that they get money out of the government.
Mike, I think they ain't seen nothing yet. I mean, I guess they're pouring out money to all those who have supported them so faithfully during the last year or two.
Yes.
And let's be honest, the funding of this, that Rachel Reeves talks about the black hole, but I think they're going to have a bottomless pit of money going somewhere, and I guess it'll be the poor old pensioners who probably get levied with the extra costs on their savings and whatever they can lay their hands on.
Right. Well, we've already seen 22% being handed to the junior doctors at a cost of 1.1 billion, which is approximately what they're going to get from the pensioners by withdrawing the winter fuel allowance. But, of course, now we've got the BMA urging doctors, having voted to go on some form of industrial action, to start already, because we're already seeing, apparently, 1 in 2 GP surgeries operating with sort of reduced hours, shall we say, seeing fewer patients already, even before announcing that they're kind of in a state of industrial strife. So they want 11%. They'll probably get it.
Yes, I suspect they will. I mean, Mike, there is a very sinister element, I think, involved in the BMA at the moment.
Yeah.
I was reading that there is a group of members of the BMA who are trying to sort of hijack the agenda,
right,
operating through social media. And I think the attitude that this will disrupt the NHS. I mean, the BMA actually said something last week, like they do the maximum to create havoc in the NHS. They weren't the exact words, but so it seems to me that any dimension of how this impacts on patients is now irrelevant to the BMA. They don't care, even if people die as a result of some of their actions. We've been through the pandemic period when the NHS devoted so much of its resource to trying to solve that and administer vaccinations and all the rest. I just think their performance is appalling.
Oh, totally. Well, luckily, there's not that many people in the BMA, are there? I mean, I think it's something like less than a third of doctors who actually work in medical business are in the BMA. And in some areas, it might be even lower than that. Certainly, junior doctors, the ones who are the sort of revolutionary types, you know, the ones who want to bring down capitalism and want to talk about Gaza all the time, you know, they're few and far between, it has to be said. And lots of doctors, when the doctors were on strike, weren't on strike because they didn't agree with it.
Well, absolutely, and I mean, but that small minority do make a lot of noise.
Yeah.
And it's like any other of these small groups. What happens in the end is that the government, especially a left-wing government, listens to a lot of lobbyists who are not necessarily representing the majority of the people that they're supposed to be representing.
Yeah.
I think also, Mike, I mean, you had a bit of a rant a few minutes ago about how awful the way things are going at the moment.
Yeah.
I think the problem here, and I think the public, much of the public, certainly the people I know and mix with, are basically losing confidence in almost anything that's run by the government, irrespective of what shade they are. It just seems that they're incompetent.
Yeah.
The scope of this isn't just in healthcare; it's right across the public sector.
Well, this is the problem, and they always say they haven't got enough money, and they've got more money than they've ever had, and they've got more staff than they've ever had. They've got more sort of burgeoning, you know, policy than they've ever had. They've got more buildings than they've ever had. You know, the government, I don't think, has ever been bigger in my lifetime than it is now.
Well, Mike, there's an article in the British Journal of General Practice this morning. As GPs have increased their income, the average partner family doctor, and that's most of the GPs, has risen from 103,000 to 153,000 in 2020 to 2012.
Right.
And that actually, they're doing less work.
Yes.
They're working less hours than they were. a lot less hours.
Yeah, well, I hear stories all the time from GPs. In fact, I was talking to somebody yesterday whose wife was a GP who said, you know, oh, she works, you know, 90, 100 hours a week, you know. I said, well, how many days, though? And in the end, it was a kind of, you know, agreed that probably it was about 3. Because the point is that, you know, they tell me, anyone who is a GP or who knows a GP says that the system's at fault and they can't make the system work. Now, I don't know how true that is. What I do know is that doctors, when I was a lot younger, seemed to be able to work a lot more and seemed to be able to do a lot more and seemed to be able to come round to your house a lot more. I knew my family doctor when I was a kid. You know, we had the same doctor for years. And lots of people will tell you that story. Nowadays, we don't even know who they are.
No. And actually, I mean, if you think about it, Mike, the GP situation today is a strange one because they are not salaried by the NHS.
No.
What the campaign is about at the moment from the GPs is to increase the level of their capitation, which is the payment they get per patient, just to have that patient on their books. I mean, in theory, they could do absolutely nothing. You know, if the patients all kept well and didn't trouble them, they'd still get the capitation money, which is the bulk of the money that they get as a practice. The BMA, the BMA don't impact the doctor's salaries. This isn't about the doctor's income. This is about the practice income. And many of those practices now are quite large organisations.
Right.
So it's a strange one with the BMA representing not people who actually work for the NHS or on the NHS payroll, but have a contract with them. They are purely subcontractors to the NHS, to NHS England.
And they've had this ridiculous rule, haven't they, which again was imposed upon them by government, that they can have a certain amount of extra money, but they can only use it for specific things, like they can't hire other doctors to come and help them with their sort of, you know, burgeoning list of patients.
They can get some money for having a physiotherapist or having some hours from a pharmacist. That was all good.
But I'm pretty sure did Wes Streeting not say he was about to reverse that?
Well, he may do. What he said is that he wants to put to rights the doorway, the gateway to healthcare by getting the family doctor situation sorted out. But I don't know quite what he means by that. And unless they are quite radical in what they do, this is unique, Mike, in this country. You know, about the capitation fees for GPs. In France, for example, most GPs are self-employed, and they're paid based on what they do, on their activity.
Right. Which would make more sense, wouldn't it, for us?
Sorry?
Would that make more sense if we ran our system that way?
Of course it would.
Yeah.
But no, nobody copies our system. The system was set up. The GPs refused to fully engage into the NHS system when it was founded in 1948. So they then became these independent practitioners who were given contracts. The contracts have been revised and changed under the Blair government. They got quite a lot more money then for doing quite a lot less. And I think this goes on. The contract doesn't need renegotiating. The system needs renegotiating. The whole way the primary care, it's not just GPs, it's practice nurses, it's the forthcoming likelihood of having physician associates working there as well, having a range of people depending on the acuity of the patient, that those things are right and are done in other countries and done very well, plus the role of the pharmacist. You go to France and also I would pay the GPs more, if you like, if they took a payment from the patients. I have no difficulty whatever in being charged £10 to go and see my GP.
Yeah.
I
think it's always been a clever move, because I think it would also stop the people who make appointments for GPs and then don't bother turning up, you know, because you'd already have taken the money off them. So I think you'd find that they'd probably be a lot more reliable. But listen, we've got to run. Thank you very much indeed. Marin Gower, the former NHS chair, on the subject of NHS doctors. And the latest news is that they're going to be asking for about 11%, and they're already not working in the way that they should. So we'd like to hear your stories on that as well.